Good afternoon, everyone, and welcome to the eBookings Lunch and Learn. I'd like to begin today by acknowledging the traditional custodians of the land on which we stand. And for me, this is Brisbane. This is the Turrbal and Yagara people, and I would also like to pay my respects to elders, past, present, and emerging. My name is Sunil, and I'm the product manager at Genie Edge Solutions, now Magentis. And today I'm excited to talk to you about our new eBooking solution. First off, I'd like to share a little background context on what problems we set out to solve with eBookings and what we have observed in our pilot. I'll then step you through the eBookings flow in both Genie and Gentu. And finally, I'll chat to you about how to get started with eBookings when it goes live at your local healthcare hospital. At Genie Solutions, our purpose is to deliver better healthcare outcomes through world-class technology. Our vision for achieving this is focused on three objectives. First, to improve the experience of patients of specialist practices using Genie and Gentu. Second, is to connect up what's a very disconnected ecosystem today. And third, is to use the data that we have to provide clinical decision support and workflow assistance to practices to improve clinical outcomes. Over the past 18 months, we've been collaborating with healthcare hospitals to make progress on our objective of connecting up the ecosystem. And through this partnership, we have developed a digital procedure booking workflow that is tightly integrated into both Genie and Gentu, and is designed to save you time when booking theatre at healthcare hospitals. And this new workflow is called eBookings. Prior to developing eBookings, our objective was to tackle three problems within the procedure booking workflow. For private hospitals, they were finding that when a specialist practice books a procedure with their theatre, key information about the procedure or the patient is often missed or excluded. And this results in a lot of chasing for this information and unfortunately lots of inefficiencies and last-minute cancellations of procedures. For patients, there was poor communication and lack of transparency with patients about their hospital stay. Some procedure bookings were being canceled last minute due to late sharing of data to the planned theatre and bed planning. So things like requirements for ICU, etc., were getting missed or getting delayed. For specialist practices as well, managing theatre lists between yourselves and the hospital was turning out to be extremely labor intensive and manual. And we know there was a lot of effort creating and changing bookings, multiple draft lists being sent each day, and both lists and consent forms going missing on a regular basis. eBookings sets out to tackle all of these problems, and I'm delighted to say that we've seen improvements across each since we started running our pilot program back in May at Gold Coast Private Hospital. During this time, a number of Genie and Gentu practices participated in the pilot, with over 1,000 bookings sent during the program. And some of the key benefits practices are seen from the eBookings are A, significantly improved practice efficiency due to reduced admin time from managing bookings. There is no draft theatre list anymore. Lost forms are avoided with bookings and consents applied on the day of the consult. Booking status is tracked in real time with feedback from the bookings team visible if action is required for the booking to be taken by the practice. Patient experience is much improved as well. Because bookings go to the hospital on the day of or soon after the consult, patients receive confirmation from the hospital that their bookings has been received. This means they're not left wondering what's happening with their procedure during this time. It also means there's an opportunity to identify any issues like health fund eligibility or other things which can cause last-minute cancellations, as previously the hospital was only aware of patients being on the list a week or maybe a couple of days prior. If you don't mind going to the next slide, Jamie. Here we've got some, so we spoke about those three challenges. One more slide, Jamie, thanks. Cool, so we've got some customer feedback here from practices and team members that have been using eBookings already. And across the board, everyone has commented on how seamlessly it has fitted into their workflow and just what a significant impact it has to the volume of work to manage eBookings. There's things like less phone calls, less chasing of practitioners, the workflow is better, and there's a lot of efficiency throughout the workflow, which is what we've observed. Next slide, please, Jamie. So with all that, we'll now have a look at what the workflow actually looks like. I'll start with Genie and talk through the workflow in some details, and then we'll go on to Gentu. For each patient that you want to create an e-booking, there is now a minimum set of information that's required to be captured in the demographic window. So this includes things like the name, date of birth, gender, phone number, address, Medicare, expiry date of the Medicare. And these must be valid or must be removed if the patient wants to utilize private health insurance, overseas health insurance as an example. If at this stage the doctor has consulted with the patient and the consent form is available, scan the form and attach it to the patient's record. As and when creating the e-booking, you're given the opportunity to attach the consent form either from your local computer or from the patient's clinical record. So if the consent's available, capture it, save it on your computer, and upload it when the e-bookings is being made, as we'll see in the next slides. The next step now is to create the procedure, which can be done either from clinical record or appointment book using the normal process of your practice. Again, when creating a procedure, there is a set of information which is required to be captured, which includes things like the procedure description, the admission date, the procedure type, and if you know, the anesthetist and the assistants that are going to help you with the surgery. In the code tab, financial information such as private funds and fee schedule must align. For example, if private fund is uninsured, then fee schedule must also be uninsured, not private. eBookings also requires that one item number is added to the code. If you're a cosmetics practice, for example, this item number can be a custom item number. For other specialties, these item numbers should be MBS item numbers for the procedure to be confirmed. Now, when you're ready to create eBookings, you've created the procedure and you're ready to create the eBookings, you simply click on eBookings button on the procedure window. If you're missing any key pieces of information in either the patient or procedure record, you will be prompted for it. Otherwise, the above eBooking window will appear, as you can see on the screen. In this window, you will select the practitioner's provider number for the hospital. When you get started, you can set this as a default, so you don't need to do it each time. And then finally, down the bottom of this window, you can choose to upload the consent form and attach the patient's record, as we spoke earlier, from either the patient's record or from your local computer. For practices who don't have consent form at the time of e-booking, there is still an option to present the consent form on the day of the procedure. Once the procedures are now booked, you can view these procedures and the status of them in the theater list. In Genie, this is accessed via appointments and then e-booking theater list. Here, you'll see the summary of the procedure information. And if a booking is identified as canceled or needs action by the hospital that you sent it to, there will be a reason provided. For needs action booking, you can simply complete the required action. So update the Medicare expiry as an example, and then update the e-booking. Next slide, please, Jamie. Cool. Now, e-bookings currently takes away the need for sending draft lists to the hospital. There's still a need to send the final theater list via usual communication methods, but there is no need to send draft lists to the hospital. When generating this list in Genie, we do ask that you select the Mark as Final checkbox and send this across to the bookings team at the hospital at least a day prior, so they can finalize the order and the timings. Now, I'm going to hand over to the lovely Tatum from HealthScope today, and she's going to have a chat to us about her experiences so far, and I'll come back and talk to you about how this works in Gentu. Tatum, over to you.
Thank you, Sunil. As mentioned, I'm the Consulting Suites Manager at Gold Coast Private Hospital, and we have been very heavily involved in the proof of concept at Gold Coast, and we have been using eBookings live now since May, so quite a few months in. I'm just going to talk to you about some of the key benefits that we have built into eBookings and also that we've been experiencing through our time using eBookings at Gold Coast. One of them is obviously the ability to send an electronic booking from Genie or Gentu software straight into the hospital WebPass software. So that is a lot safer and manages your risk there because it cannot be manipulated and there's no manual data entry involved. So eBookings allows that information that you've put into your demographics and that booking information, financial information, to make its way without anyone touching it and without any manual data entry from Genie or Gentu directly into WebPass, where it is stored safely into WebPass and it creates that booking. So there is no way the booking data can be changed. There's no way that anyone can manipulate that data. And it also improves the communication to the patient as it triggers an SMS to the patient from HealthScope. So we're seeing at Gold Coast, it cuts down those calls through to the practice asking, have the hospital actually got my booking? I haven't heard from the hospital. It's cutting down that information because on the day of consult, that booking's getting sent straight to the hospital, triggering an SMS by the hospital to contact the patient to say that they've received the booking information, and it's prompting that patient to do their e-admission and to start giving the hospital the information they need to get everything organised for that admission. So that includes staffing, organising reps in theatre, and it also includes getting financials done, so uninsured quotes and things like that. So your patient isn't finding out about money that they owe the hospital at the last minute. They're finding it out a lot sooner on in their patient journey, which is making the whole experience of admission a lot smoother for the patients. Obviously, part of that electronic booking is a consent form. So if that consent form is available on the day of consult and scanned into the patient file, which it usually is, it can be picked up and sent directly into WebPass as well, where again, it's not manipulated, it's not a manual task. It is sent directly from Genie or Gentu straight into HealthScope system and is stored in that patient file where it can be printed at any stage. So even if the doctor brings in the consent form or we're relying on the patient, they can bring in a hard copy if they want to, but we've always got that electronic copy stored in the patient file. This has been a huge game changer at Gold Coast, where we would have consent forms go missing on the day of theatre, patient hasn't brought it in, or the doctor's room have sent it up but it's gone missing, as we know happens sometimes. So this has been a game changer at Gold Coast. It cannot go missing. It's electronically stored in the patient file in WebPass and has not been touched by any of the staff, so it makes its way there electronically. Thirdly, one of the key benefits here as well is that the communication between the hospital and the rooms is now electronic. So we don't have to get out of the current workflow. We can communicate within the booking screen within Genie and Gentu by going into the eBookings button and sending things back and forth. The hospital now can communicate back to the rooms as well and ask for additional information, and that's all electronic. So before, where we had to call, we had to send emails, this is now all built into the one system and the information is received a lot sooner. So you'll get a notification straight away from the hospital when your booking has been sent. You'll know straight away if they need action. It will appear in Genie or Gentu, so you don't have to get in and out of the system to check emails or take phone calls. And you can update as you go along. So every time you make an update to your booking, you just press update and it sends the update directly through to HealthScope. So everything is built into that current workflow and built into your current screens that you use to create a booking at the moment. For the first time ever as well, you can track the live status of your booking. So because of that electronic communication, you can see the status of your booking. So you can see through Genie and Gentu when it is pending, so when it's been sent to the hospital haven't actioned it yet, and then it will change status live as the hospital goes through their process of booking it in. So you'll see if it needs any action or they need any more information from you. That will be electronic, and you can see when it becomes booked as well. So for the first time ever, we are actually getting a receipt on the practice side of the hospital receiving that booking and then being able to see that live status change throughout that booking process to when the booking is actually booked in. And we can let our patients know as well. So we can actually, for the first time ever, see that the hospital have booked our patients in, and we can let them know if patients call asking where their booking is at. A lot of the time the practices get those calls about, have the hospital got my information? Is everything okay with my booking? We can actually see that status and pass that on to our patients for the first time ever. We've also built into this a draft theatre list that Sunil was talking about earlier. So we can see at a glance, because we are sending individual bookings, so that we can send these bookings after a consult and a lot sooner than having to wait for a list or to compile a list together and send. We have built in a dashboard so that we can choose a date and a doctor and see at a glance our theatre list. and manage our theatre list electronically for the first time ever. We can see what's pending and needs action by the hospital. We can see what needs action by us, and where the hospital need more information, and we can see at a glance what's been booked in. That way, when we're ready to finalise our list, we can view our draft electronically, see that everything has been actioned and that everything is booked in, and then that we're ready to send a finalised theatre list. So this has been something that has come out of the proof of concept, and an idea that came back from feedback from some Gentu and Genie users that wanted to see things at a glance, and it's been really, really popular in the proof of concept and go live so far, being able to actually manage that draft process electronically for the first time ever, and being able to see that live status of your booking and have that ease that the hospital have done their part, and you can pass that on to the patients and communicate that back to the patient to put them at ease a lot sooner than ever before. So they're the 5 key benefits that we've noticed in the Gold Coast Private Specialist Suites over the last 5-6 months that we've been part of this project. It's just making it a lot safer and a lot easier to create a theatre booking with no manual data entry involved. And it makes that communication to the patient sooner and improves that patient experience. So anything that we can do to improve that patient experience it is worth doing for us. So we have all tried to make that change at the Gold Coast Private, and we've got a lot of doctors getting great benefit out of eBookings at the moment. Back to you, Sunil.
Excellent. Thank you so much, Tatum. That was wonderful. Now, in the interest of time, I just wanted to quickly remind you that there will be a Q&A, but that'll be towards the end. Please feel free to enter all your questions in the Q&A box so we don't miss them. We'll try to come to this towards the end. What we can't answer today, we'll definitely try to get to you by email and address those questions. I am going to speed up as I promised. So let's move to the next slide. Now, what's happening in Gentu? Well, it's a very similar workflow. Within the patient details area, the same core patient information is required. Next, if a consent form is available, we would recommend this is scanned and attached to the patient record, similar to how you would do it in Genie. It will look similar. Now, on the next step is creating the procedure using the normal process of your practice. Again, when creating a procedure, there is a set of information that's required to be captured, which includes things like procedure description, type, provider, inpatient nights, assistant, etc. And it must include at least one item number. As with Genie, each booking, as I said, will require one item number added to the billing items. Again, if you're a cosmetic practice, this item number can be a custom item number, but for other specialties, this should be from the MBS schedule. Next slide, please. Okay. Once a procedure has been created, click on the eBookings button at the top of the page. Again, if you're missing key pieces of information in either the patient or procedure record, you will be prompted for it. Otherwise, the eBooking window will appear. And then here, as you can see, once you've created the eBooking, similar to how we showed you in Genie, you can actually check out the status of that booking. So it might have been canceled, it might need action, it might be pending, as in it has not been actioned by the hospital, or it's completed. As with Genie, you can preview all these bookings. And as I mentioned, you can see the status of them. Now, when generating the final list in Gentu, we do ask that you name the list with the word final in the title of the document when generating it, and then send it through your usual method to the booking team so that they can finalize the order and the timings. That's the only difference between Genie and Gentu in terms of how the final theatre list is created. You have to call it final in Gentu. And that is it. As you can see, very tightly integrated into your existing workflow. But here I want to quickly talk about some things that we're now doing based on all the feedback that we received. So we spoke about finalizing theatre list, and that's still a manual step, right? But now we're looking to automate that. So we're creating a feature which allows you to review and finalize your theatre list, as we showed you some time back, but then send it through the eBookings application to the hospital through a fully digital workflow. So again, we're trying to remove that manual effort from your workflow. You've made a booking, you've viewed your theatre list, have a look at the timings, play around with them, and when you're ready, click send, and it'll go to the hospital. Again, we recommend that you do this well in time to give the hospital enough time to make any changes last minute. What we've also found from the feedback was notifications supporting staff like anesthetists or sales reps for prosthetics or assistants. Now, we are working on an ability for supporting staff to be notified when you're ready with the eBooking. So you've created the eBookings. You don't have to wait till the final list is ready. You can start communicating with them through the same eBookings app once this feature is available. Again, we don't have anything to show you today, but very soon we'll be in touch with you about this feature. This again looks to remove one important part of your workflow, which is still manual, even with eBookings. So that's coming up soon. And then finally, managing eBookings for ADF, so Defense Forces, Overseas Health, and work cover patients. So right now, we're working on a feature that'll help you create those bookings for scenarios where a Medicare may not always be required, such as self-pay scenarios or Defense Forces, where the claim or the funding source is DVA, for example. So that is something else that we are also working on. Very excited about all these changes that are coming up. Again, this is all based on feedback that you provided, so thank you for that. So now that you've seen how straightforward it is, you're probably all wondering what you can do to get your hands on it and start using it. So all you've got to do, if you're a Genie customer, get to the latest version of Genie on version 10 plus, and instructions on upgrading from previous to version 10s and from version 9 can be found on our knowledge base. The HealthScope booking team would also have sent you a welcome pack. Please take time to review this and familiarize yourself with the best practices workflow for your hospital, whichever hospital you work with. For Gentu, again, review the HealthScope working pack, but your hospital should already be live. So you should be able to start sending eBookings as soon as you're ready. We're ready. If you work with a HealthScope hospital, that is.